Next person here is Deputy Tommy Broughan. Keist shock the door. Took a second.
Well, Minister, as you know, on the Budget Oversight Committee early 2018, early this year, I think following a very interesting briefing from Father Sean Healy and Social Justice Ireland, we identified a very serious discrepancy in the size of the difference between the health vote, the voted expenditure, and what the National Service Plan of the HSE was trying to achieve. And that discrepancy, has turned out to be research, if you like, by the committee has turned out to be the actual case, that there is this larger discrepancy. We've had to have supplementary estimates for health and for justice once again. Now, Minister, you yourself, I think, were involved in the government in 2015 when you disestablished effectively the HSE vote, and when the HSE vote was if you like, overtaken or taken back again by the Department of Health. But since then, you haven't been managing it in particular. I mean, I think the Constein report identified these problems 10 years ago, but nothing has happened. Thanks, Karen.
Minister.
Thank you, Deputy. Managing expenditure within the overall budgetary parameters is a key factor in ensuring that our budgetary targets are delivered. As I said to Deputy Durkin earlier on, key responsibility does sit with each minister and with each government department. With regard to the health budget, spending on our health services is already at a record level. In 2017, OECD data placed Ireland 5th in terms of spend per capita amongst the EU 28. As Minister for Public Expenditure, I have made the resourcing of healthcare a key priority. This year, I will be allocating an additional €700 million by way of a supplementary estimate, bringing the total 2018 investment in health to €1.2 billion. In addition, I have also announced a further increase of €1.05 billion in health funding for 2019, bringing the total allocation for 2019 to €17 billion. This brings the investment in health over the last 2 years to a total of €2.25 billion, or an increase of 15%. The Government will continue to support the Minister for Health in managing one of our most important and complex sectors of our society and indeed in our economy. As the Deputy is aware, there are always key challenges to be addressed by the health sector. There have been supplementary estimates provided by the Dáil in many years, and this year has been no different, albeit the level of the supplementary estimate for health this year has been of a very high level. We want to provide as much as possible for people who are sick, who are vulnerable, and particularly our citizens who are elderly. I will continue, as our economic and budgetary circumstances will allow, to invest more in our health services, because I believe this is the right thing to do, and we need to tie this more into, as the Taoiseach said yesterday, for increasing the level of return for a higher level of investment.
Okay. Deputy, 1 minute.
Thanks, I mean, I disagreed with the Taoiseach yesterday because, quite frankly, and going back to our earlier discussion about the consultants, by the way, many of whom told me they would be prepared to pay a higher personal tax rate if it was hypothecated for health spending. But the reality is we do need more resources. But the issue here is that you are not accounting to this House, as is your remit, for the differences between the National Service Plan and Vote 38. That's the nub of it. And obviously there's been very serious criticism from our two key watchdogs, IFAC and Professor Coffey, say, for example, the spending drift. He calls the health vote spending drift, the difference between the plan and the health vote spending drift. It's cumulative and long-lasting, and as he says, as you said yourself, we're heading for more than €2 billion of unplanned expenditure over recent years. And even more damning, I think, is the report of our outstanding Parliamentary Budget Office called the HSE's National Service Plan's relationship with the health vote. And this, while it acknowledges that relationship is complex, Minister, and while we have a certain level of regular reporting, there does seem to be a lack of seriousness in your department about how to manage the health vote.
Thank you, Minister.
I am accountable to the House in relation to this. I answer questions in relation to the health expenditure regularly in this House and regularly in front of your committee. But, Deputy, if I had not been providing the additional funding that has been required by the Department of Health for this year, and this had resulted in dramatic changes in our hospitals, in our primary care centres, you'd be the first deputy walking into this chamber and condemning me for not taking action. So, Deputy, you can't have it both ways. You can't be on one hand saying that I am providing an additional level of investment and raising concern about it, where also, if I didn't provide the additional funding during the year, you'd be the first deputy walking into this chamber condemning me for not doing it.
Final minute.
There we go. Asking here is for honesty. I mean, this Dáil, a couple of the things that's done, I think, which will stand the test of time, is the Budget Oversight Committee and the PPO, but also the Sláintecare Committee, which probably should be sitting continuously. But we want you to implement that, and we want you to be honest about it, and be prepared to, I gave you, for example, a 43% top tax rate on salaries over, what was it, 130 or 120, 130 grand. There are measures that we can take to get the vote together. But I mean, the conclusions of the PBO's report, they are a bit damning in relation to your department's management, of the health vote. I mean, it seems that the alignment of the National Service Plan and the alignment of the vote, it's impossible to make. Money is voted, and then we get elements of expenditure under the National Service Plan, and the two of them don't correspond.
Thank you.
And this seems to be the fundamental. There's a lacuna here, Minister, which I think you should, address on behalf of the people. Whether the health vote has to go up to 40 billion, whatever is necessary, but that it would be accounted for to us properly.
Thank you. Final
it is accounted for properly. I mean, as we speak at the moment, the HSE is in front of the Oireachtas Health Committee dealing with this matter. Minister Harris is regularly in front of the committee as well, dealing with issues on it. And I, as I said to you, Deputy, deal with questions in relation to this regularly, principally from yourself. And I will acknowledge, actually, because it's only fair to do so, that the pre-budget submission that you put in, Deputy, does raise how additional resources would be generated. I want to acknowledge that. As you know, my view, though, is that some of the measures that you are looking to implement would have very, very damaging effects on jobs, on incomes within our society, that in turn would then affect our ability to put in place the kind of investment that is needed in our health service. What we do need to have happening now, particularly as we move into 2019, and myself and the Minister for Health are committed to doing this, is putting in place a structure to ensure that the kind of difficulty that developed this year does not happen in the way it did for next year. And in regard to that, I particularly welcome the fact now that we've appointed an executive chairperson for the HSE.
Thank you.
And I look forward to working with him in relation to this issue.
We're going to move to the next question.